Assalamualaikum. In this video, we are going to tackle postoperative nursing management. So, the postoperative nursing management are care that the patient receives after a surgery to ensure the patient's proper healing and to prevent infection. Learning objectives. At the end of this chapter, the learners will be able to describe the responsibilities of the post-anesthesia care unit nurse in the prevention of immediate postoperative complication. The second is compare postoperative care of the ambulatory surgery patient with that of the hospitalized surgery patient. And the third one will be able to identify common postoperative problems and their management. And also, the learner will be able to describe the gerontologic considerations related to postoperative management. And also, will be able to describe the variables that affect wound healing and demonstrate postoperative dressings techniques. The learners will be able to identify the assessment parameters appropriate for the early detection of postoperative complication. Patients, after the surgery of the patient will be placed into post-anesthesia care unit. This is where the patient will be monitored. This is a recovery room. The patient will be monitored by the nurses in this room, where the nurse will be assessing the patient, like assessing the patient's vital signs and monitor the patient's patent airway, but mostly the pain management and the wound healing. In this postoperative care unit, the room must be soundproof, isolated, and also the paint of the room must be soft in color, because this feature will help the patient's recovery and reduce the patient's anxiety, and also will provide the patient's
So we have phases of post-anesthesia care. So post-anesthesia care unit, it is also called the recovery room or post-anesthesia recovery room. It's located adjacent to the operating room suite. So next is we have three phases. So the phase 1 is the used during the immediate recovery phase. Intensive nursing care is provided. So sa phase 1 na to, yung pasyente is nag-recovering pa lang sila from the surgery. So merong nursing care na naka-provide dito. So next is the phase 2, post-anesthesia care. So wherein the patient is prepared for the self-care or care in a hospital or an extended care setting. So sa phase 2 naman, ito yung kung saan yung patient is nag-start na sa self-care nila. So, no need na yung nursing care na nagpo-provide dito. So, sa next phases is the phases 3, PACU or post-anesthesia care. So, wherein the patient is prepared for discharge. So, sa phase naman ito yung mga pasyente na pwede nang lumabas or pre-prepared na silang lumabas from the hospital. Nursing management in the PACU. The nursing management objectives for the patient in the PACU are to provide care until the patient's recovered from the effect of anesthesia. So, merong 8 management. First, we need assessing the patient, maintaining patent airway, maintaining cardiovascular stability, hypotension and shock, hemorrhage, hypertension and dysrhythmias, relieving pain and anxiety, and controlling nausea and vomiting. So, there are 8 nursing management in the post-anesthesia care. So, kailangan natin bantayan yung pasyente gamit yung 8 na yon, yung management na yon. So, kailangan natin i-assess yung pasyente natin, titingnan natin kung yung oxygen saturation ng pasyente natin, yung pulse rate, yun yung chine-check, yung kung regularly ba, at saka level ng consciousness ng pasyente after the surgery. So next is kailangan din maintain yung patent airway ng patient. So para ma-prevent tayo ng hypoxemia, which is nare-reduce tinitingnan doon na kung nare-reduce ba yung oxygen from the blood of the patient. So, yun yung mga uh, ina-assess ng nurses. So, next is kailangan din i-assess yung maintaining cardiovascular stability. So, dito, yung mga nurses is monitor nila to, wherein yung nurses kailangan i-check always yung vital sign ng pasyente na yon. So, titingnan nila kung may nangyari ba, may naiba ba sa pasyente. So, next is hypotension and shock. So, after the surgery, so meron na mga nangyayari na hypotension and shock. So, dapat tinitingnan nila, chine-check nila yon. So, titingnan nila kung ano yung side effect ng anesthesia na yon sa katawan ng patient. Baka magkaroon yun ng hypoventilation. So, which is magre-result yun siya sa blood loss. So, titingnan din nila yon. Titingnan din ng mga nurses yung kung meron bang cardiac rhythm, so skin temperature, yung color, moisture, pati urine output ng pasyente. So, para makasigurado sila. Hemorrhage. So, eto, kailangan din itong i-assess ng nurses kung meron bang nangyaring hemorrhage after the surgery, because the hemorrhage is the uncommon yet complication surgery that can result in death of the person. So, kailangan ito yung palaging chine-check ng nurses. So, next is the hypertension and dysarrhythmias. So, titingnan din to ng nurse kung meron ba nangyayari dito, kung nagtaas ba yung RBC niya, at saka kung meron bang electrolyte na nangyayari sa pasyente niya. So, kailangan din chine-check yun, minomonitor yun. So, next is the relieving pain and anxiety. So, kailangan din minomonitor ng nurse na naka-assign kung meron bang masakit or nagkakaroon ba ng anxiety yung pasyente niya. So, kailangan kasi kung if that case nagkaroon, kailangan siya i-introduce sa kanya o i-administer sa kanya yung opioid analgesic, which is ito yung medication na nagre-relieve ng pain. So, kung nagkakaroon man siya ng anxiety, so pwede tingnan mo sa niya kung ano yung pwedeng sa kanya, kung ano pwedeng gawin. So, pwede din mag-stay yung mga family member, so hanggang sa gumaling na siya, hanggang sa tuluyan na siyang gumaling. So, next is controlling the nausea and vomiting. So, eto dapat minomonitor din to siya ng nurses kasi bago pa mag-leads into complications. So, kailangan titingnan kung meron na nakita na nagkakaroon siya ng nausea, yung parang nasusuka siya. So, kailangan na i-report agad ito para hindi na mag-leads pa into vomiting na magsusuka na talaga siya. So, yun yung 8 nursing managements kapag nasa post-anesthesia care. So, yun yung sinusunod nila para maging easy lahat, easy, at saka yung patient nila is makarecover.
So, good day. So, my topic is about the postoperative nursing management learning objective number 2. So, the inpatient and outpatient surgery can be both performed in the hospital. But the difference between the ambulatory surgery patient with the hospitalized surgery patient, so the ambulatory surgery patients, sila yung mga patient na after the surgery is pwede na silang i-discharge. But after the procedure, the patient are monitored in the posto anesthesia care unit, which is the PACU, or an outpatient postoperative care area. So, patient is typically stay until they drink water without nausea, urinate, or perform other tasks required by the surgeon. So after yung patient is bibigyan na sila ng task ng surgeon, kung okay na ba sila after the surgery, is pwede na silang ilabas or i-discharge after the surgery. So, yun yung ambulatory surgery patient. So, yung inpatient surgery or the hospitalized surgery patient, so on the other hand, occurs when a surgical procedure is performed with the expectation that the patient remains in the hospital for one more night. So um, the following post-surgical recovery period is yung mga inpatient surgery patient stay at the hospital one for at least one night. So, yung mga surgery patient na required mag-stay sa hospital after ng surgery is yung mga trauma patient, acutely ill patient, yung mga patient undergoing major surgery, yung mga patient who required emergency surgery, and at in yung mga patient na neurologic surgery may be added to specialized ICU for those monitoring and advanced interventions. So, the extent of postoperative care is required siya. It depends on the types of surgery, or the surgery was performed in a day surgery setting or in the hospital setting.
Good morning. My reports all about collaborative problems or potential complications. So, ito yung mga complication na meron. Pulmonary infection or hypoxia, deep vein thrombosis, hematoma or hemorrhage, infection, pulmonary embolism, and wound dehiscence or evisceration. So, first, the pulmonary infection or hypoxia, ito yung causes and changes sa ating lungs na apektado yung ating breathing. So, as a result, hindi tayo makakakuha ng enough na oxygen or yung katawan natin. So, nagli-lead siya into hypoxia. So, yung hypoxia, ito yung having low level of oxygen in the blood. So, pati yung cell and tissues natin is affected. Kasi nga yung cells and tissues natin kailangan nila ng continuous supply of oxygen para sa metabolic process. So next is the deep vein thrombosis. So itong deep vein thrombosis, medical condition na nag-occur kapag yung blood clot is nag-occur sa ating vein. So yung blood clot na to is usually na-develop sa ating lower leg, sa thigh, or sa pelvis. And yung main cause nito is maybe sa damage to a vein from surgery, or the inflammation due to infection or injury. Then next one is the hemorrhage. So yung hemorrhage is acute loss of blood from the damaged blood vessels. Possible cause nito is the car accidents, bullet wounds, impalement, pagkahulog, explosions, and crash injuries. So next, infection. So yung infection, ito yung the invasion and growth of the germs in the body. So yung mga germs na ito pwedeng bacteria, viruses, yeast, fungi, and other microorganisms. Yung mga infection na to is pwedeng magsimula sa kahit sa anong parte ng ating katawan, at pwede itong mag-spread din kahit saan. So, meron ding mga infection na nagkakos ng fever and other health problems. Depende kung saan ito nag-occur sa ating katawan. Then, next is pulmonary embolism. So, yung pulmonary embolism, ito yung caused by a blood clot traveling from one of the deep veins in your body. So, ito yung parang mabagal na pag-circulate ng blood, nagkakos ng clump of blood or tinatawag na blood clot. Yung usually sa leg to siya, and this kind of blood clot is tinatawag na deep vein thrombosis. In some cases, the blood clot occurs because of the changes sa ating physical condition, such as the pregnancy or recent surgery. Then next one is the wound dehiscence or wound evisceration. So magkaiba tong dalawa na to. Yung wound dehiscence, ito yung opening of surgical wounds, and yung wound evisceration, ito yung when the organs come out from this surgical wound. So may picture akong nilalagay dyan. So yan yung pinagkaiba ng dalawa. So that's all.
My topic is promoting wound healings. So, promoting wound healings, we have a first intention healing, second intention healing, and the last is third intention healing. So for the first intention healing is a wound made aseptically with a minimum of tissue distraction that are properly closed, held with the little tissue. So reaction by first intention. So when wound rather held by the first intention healings, granulation sa tissue is na kapag hindi visible at ang scar formation ay minimum. So ang postoperatively, many of those wound is ay dapat i-cover with a dry sterile dressing. So kapag ang cyanocrylate tissue adhesive liquid band, so dapat natin i-close ang incision without suture or dressing, rather is a contraindicated. So for the second intention occurs in the affected wound, or wherein wound in which the edges na meron na hindi na approximated. So kapag ang abscess is incised, it collapse partly rather, sa ngunit ang partly rather at and the dying cells to forming its wall are still being released into the cavity. So for this drainage, two or goes the inserted into the abscess, packing to allow drainage to escape easily. So for the last intention healing is so the last is this one, third intention healing. So this one are the also packed post-operatively with the most gauze, and also covered with a dry sterile dressing. So as a wound heals, many factors such as adequate nutrition, cleanliness, rest, and position determine how quickly occur. So yun na guys, kapag example, kapag ang patient mo na may nasugatan, so dapat natin ugasan, i-clean muna natin yung wound na yon, at saka i-observe mo na, then pwede i-apply mo na yung gamot, like example like betadine na i-add mo yun sa cotton or gauze. I-apply mo yung betadine doon sa cotton, and then i-apply mo ilagay mo na sa wound, or na yung sugat na yun ilagay mo na yung cotton na sa sugat na yun. So then i-apply mo na dry dressing. So yun lang ang third intention healing. So ito yung ipapakita ko sa inyo ng picture. So ito yung picture na first intention, second intention, and third intention. So first intention, we have a clean incision. Ito yung the first is clean incision rather. So At second naman is early suture. So is there we have a hairline scar. So the second intention rather, so gaping irregular, ito yung itsura ng gaping irregular wound. Yan gaping irregular wound. So sa meron naman granulation. Yan ang itsura ng granulation. At the last is epithelium grows over scar. Ito ang itsura niya. So the last intention is ito yung wound na yan. Ito yung wound. So increase the graduation. Ito yung increase the graduation. And sa late na suturing with a wide scar. Ito yung late na suturing with a wide scar. So yun lang ang promoting wound healing scar. So the next is Phases wound healing. So phases wound healing, inflammatory, also called lag or exudative phase. So ang duration niya 1 or 4 days, and ang event niya blood clot forms, wound becomes to edematous, debris of damaged tissue, and blood clot are phagocytous. So the next is proliferatives, also called fibroblastic or connective tissue. Connective tissue phase. So ang duration niya is 5 or 20 days. At ang events collagen produce granulations, at granulation tissue form wound, tensile strength increases. So the last is maturation, also called differentiations, resorptive remodeling, or plateau phase. So ang duration niya is 21 days, 2 month, or even years. So ang event niya is fibroblastic leaf wound, tensile strength increases, collagen is fiber recognized and tightened to reduce scar size. That's all.
Hello everyone, my topic is about factors affecting wound healing and assessment of parameters appropriate for early detection of postoperative complication. So when we say wound healing, wounds that experience impaired healing including delayed acute wound and chronic wounds generally have failed to progress through the normal stages of healing. Such wounds frequently enter a stage of pathologic inflammation due to postponed, incomplete, or uncoordinated healing process. So the first one is the age of the patient. So when we say age of the patient, research has shown that people over the age of 60 may have delayed wound healing. The second one is the handling of tissues. There are three steps in tissue repair wound healing, which are the inflammation, proliferative, and remodeling. So handling of tissues, rough handling of tissues cause injury and delayed healing. The third one is the hemorrhage. So bleeding, also called hemorrhage, is the name used to describe blood loss. And also hemorrhage appears when your skin is cut, scraped, or fractured that the person usually starts to bleed. And the fourth is the hypovolemia combined with relative hyperfusion and reduction in oxygen delivery lead to further tissue injury. And the fifth one is the edema. Edema, formerly referred to as dropsy or hydroxy, is the swelling of the body's tissue due to excess intestinal fluid retention. So for the assessment of parameters appropriate for early detection of postoperative complication, we have four. So the first one is the DVT, or also known deep vein thrombosis, is one of the most treated complication of in postoperative patient and is associated with considerable morbidity and mortality. So majority of the patient with postoperative DVT are asymptomatic. So the second one is the pulmonary complication. Postoperative pulmonary complication is the umbrella term of adverse changes to the respiratory system, including immediately after surgery. The most common presentation include an altered function of respiratory muscles, reduced lung volume, respiratory failure, and atelectasis. So the third one is the hematoma. Wound hematoma, a collection of blood and clot in the wound, is a common wound complication. Is usually caused by inadequate hemostasis. And the last one is the infection or the wound sepsis. So any wound that isn't properly cleaned and covered can allow bacteria, viruses, or fungi to enter through the opening of the skin that leading to infection. And when we say sepsis, sepsis occurs when the body overreacts to infection, which cause organ failure and death. So that's all for me.